Well, thank you. Thank you for inviting us to be part of your Congress. I know we are on the last day, but I trust that your Congress has gone on well. This is a RANSCO session. So this is a session that is jointly populated by people from the Royal Australia and New Zealand College of Ophthalmologists, as well as the All India Ophthalmic Society. The links between RANSCO and AIOS go a long way, and I think they've been getting stronger as the years go by, and COVID has not been able to shake this association, and I think it's just getting better. I am pleased to see that you are all coming out of the wave, but I suspect that we are getting into one now here in Australia. So, but as usual, we have a lot to learn from each other, and I'm pleased to note that the breadth of speakers are from Tasmania, where I am at the bottom of Australia, to WA, and then on to Coimbatore in India. So you're spanning half the globe if you were to measure how far we are apart, but we're together. We're going to talk about the modern management of diabetic retinopathy. And I'll introduce the speaker and the topic as we start. But basically, over the years, we made a lot of progress in the management of diabetic retinopathy. And I'm sure all of you remember the days when we had no treatment. And then when treatment was there, the treatment was slightly better than the natural history of the disease. And then we now gotten to the state where we are looking at not only saving or stopping the decline, but actually restoring vision. So the advantages of technology have really been put into the field of diabetic eye disease. The advent of intravitreal anti-VEGFs, the advent of better lasers, the better intravitreal steroids, and of course surgical techniques have gone a long way. But I think world over we are stuck with one major issue, and that is catching the disease early, because if you catch something early, so you get early diagnosis, you get prompt treatment, you get a better outcome, and that is a universal truth, and I think we're all struggling with that. But that aside, I think we might get on to today's talk on diabetic retinopathy, and to start with, I'd like to invite Professor Hessam Razavi, my colleague from WA, who's going to talk about the management of diabetic macular edema in the indigenous population in Australia. And so we're going to have 15 to 18 minutes talks each, and we might reserve the questions for the end, because we'll have plenty of time for that. And so if the audience would like to send in their messages through the chat box, that might be easier. But anyway, here we are. Over to you.